So we know that human health is affected by a natural environment in many ways. And one important factor is this interconnection highlighted in the brown box here between our health and soil, agriculture, nutrition, and food security. And this interconnection works in both ways. So not only does our environment affect our food system and contributes to the quality and quantity of food that's available to us, but our food system also affects our environment. And we know that it's one of the leading contributors to global greenhouse emissions, as well as impacting on things like soil degradation and water quality. So over several decades, we've seen a considerable change to our food system. It's been dubbed the nutrition transition globally, and it's involved a global dietary shift away from fresh, healthy foods like fruit, vegetables, fiber-rich staples, and an increasing access to ultra-processed, energy-dense, nutrient-poor food, including things like sugar-sweetened drinks. And this poor diet is contributing to a double and in some cases triple burden of malnutrition globally, where we're seeing persistent stunting and wasting in children under 5 existing alongside overweight, obesity, and also micronutrient deficiencies. So for example, we see high prevalences of anemia in women of reproductive age. And progress in tackling these burdens globally is slow and certainly not on track to meet global nutrition targets for 2025. So this triple burden of malnutrition is seen at its highest rates in small islands or small island developing states. They're mainly distributed in the Caribbean and Pacific regions, as you can see on this map, and they are countries that are disproportionately affected by environmental impacts on their food system, as well as the health impacts of their food system. And one of those impacts on their food system, on the food system in small islands, that's increasingly affecting food security is climate change. So we're seeing increasingly frequent extreme weather events and natural disasters that are affecting local agriculture and access to food, and then subsequently access to health. And it's in these vulnerable small islands that we see the impact of climate change most prominently reversing progress in tackling global hunger. So the food systems in small island states are increasingly reliant on imported food. So that's mainly ultra-processed food and drinks over fresh local produce. So the FAO and others have suggested that the ratio of imports to domestic production needs to be rebalanced, because even where we see local production remaining relatively high, we see that large amounts of that food is then exported to generate income for potentially purchasing ultra-processed imported goods. And so globally, from here in Cornwall to Fiji in the Pacific, there is this growing interest in the value of strengthening local food production for local consumption, ensuring that local food production is resilient, able to withstand these shocks, to feed local communities, ensure people have a nutritious diet, and also a focus on monitoring the impact of these initiatives on our health and also on the environment. And so for the last 5 years, we've collaborated from the centre with partners in the Pacific and the Caribbean on various research projects that focus on this concept of local food. And as part of these projects, we've worked with regional academic organisations, non-government organisations, and local governments to co-develop methods and tools for evaluating community food interventions locally. And as part of those collaborations with those teams, we've co-developed tools to explore the links between how people source their food and the quality of their diets. And we've applied these tools to cross-sectional work in Fiji and also St. Vincent and the Grenadines in the Caribbean. And the findings of that work have been really interesting. We can see that there may be a link between how people source their food and the quality of their diets or their dietary diversity. as well as their experiences of food insecurity. And so this is something that we are exploring further at the moment, and we're doing that through co-designed research projects. So we work with local NGOs who have years of experience in running interventions to get people producing their own food, and they run these existing interventions, and we're helping to evaluate the impact of those interventions using our co-developed tools. So one example in Fiji is our partnership with the University of the South Pacific. So here on the left is Billy from their Centre for Environment and Sustainable Development. And then on the right is Sashi, who is the director of the amazing NGO Friend. They provide education, skills and resources for building and maintaining backyard gardens to improve household nutrition. And Sashi and her team run the 9x9 backyard garden initiative. So that means setting up a garden where they grow 9 types of 9 varieties of food. So these are just 2 examples of 2 varieties, say root, veg and fruits, but they'd also include 9 varieties of, say, like leafy green vegetables or herbs, etc. And the aim is to increase diversity in what households can grow in their backyard, and then subsequently diversity in the diet that they feed to their family. So in this project, we're aiming to use our tools to evaluate the impact of this programme on local diet and broader health. So in a broad sense, our work aims to help communities towards resilience to climate change and to their food systems for better nutrition and health. Our partners have strong links with local governments and work hard to influence policy change. So it's truly collaborative work that's providing important evidence for change. But these partnerships with international organisations and the evidence that we produce as a result of the work that we do would just not be achievable without the support from the European Centre.